And back to that story which you heard there on the news bulletin about the HIQA report out just this morning. Serious concerns raised about patient safety at University Hospital Limerick. Michael McNamara is independent TD for Clare and is with me on the line. Good morning to you.
Good morning, Claire.
What do you make of this report?
Well, it makes one very angry as a representative of the Midwest to read it and to read how inadequate the hospital is and how it's come to this and how it's been let come to this. It's failing in providing for patient dignity. It's failing in management. It's failing right across the board. It's grossly overcrowded. There's a hint in it, because I don't think it's within HIQA's remit to point to a long-term solution, but the fact that there's one Model 4 hospital in the region is contributing to this. And they talk about the numbers going through that emergency department and compare it to Dublin, and where there's a gross difference. And yet, this year, 411 acute and 36 ICU beds were scheduled to open across the state this year, all of them in Dublin and Cork, none of them in Limerick.
Yeah, it's interesting,
clearly great.
Michael McNamara, the HSE response, within that it says it's going to explore the provision of a Model 3 hospital in the region to support activities undertaken at UHL. Yeah. So are you saying it's clear that there's another hospital needed there?
It's clear that the capacity is not there. I mean, it's clear that there is an insufficient capacity there to provide a decent healthcare service in the Midwest. That's clear. It's equally clear that the management in UHL are failing from this report, unfortunately, and it's not something I say lightly. It's not something that gives me pleasure to say, but I mean, it is difficult to see how they can just say brush off the blame and say that, oh well, we'll work with Sláinte Care and we'll work with this, we'll work with that, when staffing have been inadequately managed. That's a very clear finding in this. And I mean, given the circumstances that exist there, given the dire pressures that are on there, the least that should be done is that existing capacity should be properly managed, and that's clearly not happening from this report.
To look at the report again, it said the hospital is not planning, organising or managing nursing staff levels to ensure that high quality, safe and reliable healthcare is provided. And the result of that is that we see in this report that we had one person on a trolley for almost 5 days. 5 days, another person 85, another 71, people waiting for hours on end in ambulances. Now, as I was saying to Simon Carswell earlier, it is one thing, isn't it, if you have an avalanche of patients descending for whatever reason on a hospital on a given day, the HIQA inspectors come in and announced it that same day. That's just an unfortunate coincidence. But what HIQA is saying is they're not planning for this. They're not organising their rosters properly or managing their staff properly.
That's what they're saying. I mean, as I say, it's not something that gives me pleasure to say, but it's a damning indictment of management. It's difficult to see how their position is tenable at the moment. Now, I know that there's an expert group that has been sent down. I've raised that in the Dáil. I've asked what are their terms of reference. I haven't been told. The Taoiseach said he'd come back to me. He didn't come back to me. I wrote to him to ask him what are the terms of reference and to whom are they reporting. In particular, do their terms of reference include reporting on when we need an additional Model 3 and a Model 4 or a Model 4 hospital in the region. He didn't come back to me. I raised it again in the Dáil and he tried to brush it off as a HSE matter. I mean, this is a governmental matter. This is a failure of government. There's a lot of claptrap about the celebration of independence, a republic. One of the most basic principles of a republic is that people are equal. We have a right to an equal healthcare system in the Midwest.
Are you calling for resignations?
I'm calling for a management system that's capable of managing existing resources and pointing out where the resources are inadequate. We don't have either in the Midwest at the moment. It's that simple, unfortunately. It's very clear from the report.
Okay, I just want to bring people a reaction from the hospital. So this is Professor Brian Lenihan, who's Chief Clinical Director at the UL Hospitals Group. He said, we've closely examined the findings of the report. We're working with HIQA and the HSE on short, medium and long-term plans to improve the experience of patients. We acknowledge that the measures in our escalation plan are not sufficient to meet the unprecedented increase in demand on our service. This is not for want of effort or commitment on the part of the management and staff. And he goes on to say, the Midwest and UHL has many unique challenges. We have fewer inpatient beds, fewer consultants and non-consultant hospital doctors to provide care than comparable hospitals. We serve a region with a higher frailty index and a city with a higher deprivation index. Over the course of the pandemic, our ED did not see the scale of reduction in presentation seen around the country, and the growth in demand in our hospitals since has also been disproportionate and exceptional. It sounds to me that they can't cope with the resources that they have.
It sounds to me like the resources they have are inadequate. I mean, poverty in pockets of Limerick is not something new, unfortunately. It's been with us since the foundation of the state. Successive governments may have failed to tackle it adequately, although there were efforts in Limerick regeneration to do so. But, pointing to these issues that we've known about since the foundation of the state is not getting us to a solution. I completely accept everything he says. There's a lack of beds, there's a lack of non-consultant hospital doctors, there's a lack of consultants, there's a lack of healthcare capacity. It's all of that. But on top of that, to make it worse, there's a lack of being able to manage existing resources, which comes out of that. And that, for me, is what's most disappointing. I mean, they're equally disappointing, but we do need now, at a government level, when Tony Blair came to power, he took over the reform of the NHS because he realised that it had to be in the Prime Minister's office for it to actually happen. Otherwise, it was just going to be a lot of talk, a lot of plans, and nothing would happen. We need the Taoiseach. He might not be from Limerick. He might not care about Limerick. I actually think he does care about Limerick. We need him to take somebody to have a junior minister in his department who's answerable directly to him, so he is answerable to the people of the Midwest for the provision of a healthcare system. Mm-hmm. And he is a politician with considerable experience in healthcare. He was a minister for health. He set up the HSE. He knows his way around the healthcare system. He needs to take ownership of this, and it needs to be delivered, because it is not acceptable that there are different levels of healthcare system depending on, or that you can expect to receive a different level of healthcare depending on where you live in this very small little state 100 years after independence.
I think it's worth mentioning that the HIQA report said staff on duty were observed to be kind and caring. All patients who spoke to inspectors were complimentary about nurses, describing them as lovely, very helpful, and doing their best. And
they're at their wits' end
I'm sure
with the capacity issues there. I mean, having spoken to, I have friends who nurse there, neighbours who nurse there, and I've brought family members in there, and I've seen the pressures that the staff there work under. It is simply wrong that there's such a difference between the healthcare system that's been delivered to the people of the Midwest through Dúradóil and the healthcare system that's been delivered in other parts of the country. And I've seen that through family members, and the discrepancy in the healthcare that they receive. It is wrong, it is inadequate, and the Taoiseach needs to act on this.
Michael McNamara, Independent TD for Clare, thank you for joining us.